My final point, Lord Carlile, is that this juxtaposition has exercised several child abuse inquiries during the 1990s into various malpractice in residential care, including the Staffordshire Pin-Down inquiry, the Aycliffe inquiry, the inquiry into abusive practice in the government's own youth treatment centres at St Charles and Glenthorne, the institutional harm caused to children then, the lessons learned then, and the government's commitment then are no less relevant now than they were then. Thank you.
Thank you very much indeed for the clarity and, if I may say so, unambiguous nature of your views. Mr. Stevens, I noticed from your written evidence that you have some experience and knowledge of youth custody in other countries.
Yes.
Is there any knowledge from other countries that informs the views you've expressed today and in your written evidence?
Well, it's very similar to the comments I made about trying to compare the regimes of secure children's homes and youth treatment centres and STCs. They're very, very different. And to say that one has a higher or lower use of physical restraint doesn't really tell you very much. Because if you were to have, for instance, children in a segregation unit for a long period of time when they're not associated with anybody and they're locked in a bedroom for several hours or weeks, then you're not in a position to restrain them anyway. So restraint is going to be low. But you asked a question, and I thought you might ask that. So I did some research of the establishments which I've looked at in Europe, and their restraint numbers for comparable sized establishments, say between 80 and 100 residents, pan out at about 1 per month. It is very, I've never seen one in the establishments in Europe that I visited, so I had to look at their CCTV, and because they just don't happen. But the establishments themselves are different because they're staffed differently, different type of person is based upon social pedagogue, and that the children have a journey of travel which starts off secure at the beginning and then moves into semi-secure, with children going out into the community to go to school, for training, work experience and all those sort of things, and then they move into an open part of the establishment. Their journey of travel forms a fundamentally obvious incentive for children to get on with the kind of treatment programs or the care plans that Paul Cook was talking about earlier on. One of the problems with our establishments, and it's certainly taken place in the last 10 to 12 years, is that they've become totally closed. Very little examples of youngsters going out to school, the sort of things which I talked about, or going home to their parents, and the sort of resettlement that you want to see, or the integration processes that you really want to see.
I think it's recently as 2007 that you were head of Oak Hill SPC, is that right?
Yes.
Would you like to make some comments about the level of cooperation of the Youth Justice Board in the training of staff in issues relating to restraint and similar matters? Did you find that the YJB was straightforward, imaginative and cooperative, or do you think that they've got quite a lot to learn?
That's quite a hot potato question, in fact. And I can't remember the Youth Justice Board being particularly helpful or unhelpful.
What about training techniques that you were attempting to use whilst you were there? You have something to say about that in your written evidence. Could you just explain a little bit more about that?
Well, yes. Shortly after I gave evidence at the inquest into the death of Gareth Myatt. That was in July 2007. And one of the recommendations by Judge Pollock, the coroner, was that staff should receive, all staff who are required to use PCC, physical restraint, should be given a copy of the restraint training manual, PCC manual. I think that's probably what you're referring to. So I duly sent out to all members of staff, total of about 200 copies, and with various other guidance from myself about the dangers of positional asphyxiation and all those sort of things, and personally saw every member of staff to give them a copy and to explain what the purpose of that was. And now I cleared that with the Youth Justice Board. In fact, with the monitor at Oakhill, and as I recall, around about 2 months later, the Youth Justice Board in London asked me to recall them all.
Did they give reasons?
Yes, the reason was because the PCC manual was a confidential document, and that it might lead to security breaches.
Right.
If you want further explanation of that, perhaps
I think we would take a long time to achieve further explanation of that.
The rationale was that it was what I had done was to reveal the inner secrets of the restraint techniques which staff would use, which would inform children and young people who would be able to take counter-defensive measures, something like that.
Right. Well, let's move on to training in more general terms. What are the key recommendations you would make that would improve training of staff and lead to a reduction in the use of restraint?
Well, I think so far as, my view about the training of staff in secure children's homes and secure training centres is that they are broadly similar. STC staff have to have certain prescribed training to ensure consistency and to ensure the delivery of the regime, and that's laid down by the Ministry of Justice and Home Office. The content of their training was drawn from Department of Health guidance for staff working in secure training, secure children's homes. They're broadly similar. I'm not really qualified to give you much information about the staff training in wild homes. But essentially, children's homes have various staff training requirements. They apply in secure children's homes, and they apply rightly in STCs. That's really all I have to say. I've never actually found that there is a co-relationship between the staff and the training, particularly. I don't have much comment to say about staff training, that's why I haven't said anything. It's okay.
You say that hybrid training is not advisable. Can you expand on why staff should not be taught non-compliant techniques and compliant techniques together?
Well, I don't think they can, simply on the evidence that was available to me from the secondment of prison custody officers to Medway, when CNR pain compliant trained staff were seconded from Group 4 prisoners to assist staff in the STCs. Those staff were retrained in favour of non-pain compliance, and every member of staff was briefed about the dangers of using and the illegality of using pain compliant techniques. Still, it didn't stop pain compliant techniques being used, and that is a matter of historical fact because it was reported in various inspection reports and Home Office evaluation reports of Medway STC. In talking to staff afterwards and in talking to other staff since who have previously been been CNR trained and who have subsequently been PCC trained, in the intensity of a physical restraint, they told me that they felt it was almost impossible not to resort to pain compliant techniques. Simple as that.
What is, in your view, the single most effective change of policy that improve the situation for young people